Hey everybody, this is Eric Mishi, SAVE Executive Director, Suicide Awareness, Voices of Education, and we are thrilled to be back again having some more conversations as a part of this week's Suicide Prevention Awareness Week. We have had some incredible discussions throughout the entire week with so many folks that are doing incredible work all over the country, not only talking about mental health, talking about suicide awareness, suicide prevention, and what each of us can do to play a role in helping save lives. And from the very first conversation to what will be the end of our conversations this week, every person that we've talked to has had a direct impact on the issue of how we can all play a role in the work that we do to help save lives and communicating the resources that are out there. And one of those resources, one of the emerging, very important resources is 988. And I'm thrilled to be here today with the Vibrant Emotional Health Vice President 988 Strategy, Wendy Martinez-Farmer. Wendy, thanks for joining us today.
Thank you so much for having me. I'm happy to be here.
Well, so let's talk a little bit. Let's start with maybe sharing with people your background, and then we'll kind of dive right into a conversation about 988.
Sure. So I'm a licensed clinician. I'm a licensed professional counselor by training. I've worked in crisis services for 26 years. Worked really all over the crisis continuum, but have done a lot of work in crisis call centers and mobile crisis response. I had the privilege of operating the Georgia Crisis and Access Line for 10 years and mobile crisis in a lot of the state of Georgia. Have been involved in the development of helplines and hotlines in multiple states since then. But in April of this year, I had the privilege of coming on board at Vibrant Emotional Health. So I think I'm starting month 5. And I'm could not be more honored. I was telling someone the other day, I cannot imagine when I started working in this field. I don't think we could ever have imagined that 988 would come to fruition. I don't even think it was a thought in our mind at the time. And just knowing that this tremendous resource that so many people have come together to make it happen over the last several years. We're standing on the shoulders of many giants who did that. And I just feel very honored to be able to contribute in any way that I can to its success.
So let's talk a little bit about Vibrant first, so people understand Vibrant and its connection to 988 and
Sure.
And maybe share with folks about how that all works with you, with Vibrant and other folks that are involved in 988.
So Vibrant Emotional Health, we were formerly the Mental Health Association of New York City, and have been involved in the administration of the National Suicide Prevention Lifeline for quite some time. But we are currently in a cooperative agreement with the Substance Abuse and Mental Health Services Administration to administer the 988 network. So there are 216 crisis centers, independent crisis centers across the country. And it is our responsibility to work in collaboration with SAMHSA to administer those centers.
So that's a lot of responsibility, a lot of coordination, a lot of logistics. And so let's talk a little bit about, share with people who may not understand kind of what is the structure of 988 look like. And so as we talked about before we even started here, it's not like somebody woke up one day and said, we're going to do this 988 thing, and they pressed a button and it all went live, right? There was a lot of work, as you said, standing on the shoulders of giants. A lot of work went into that. But share with people how that overall 988 system is actually structured across the country.
So it's probably good to have just a little bit of history. The National Suicide Prevention Lifeline went into place in 2005. And at that time, I think there were about 100, centers across the country that answered those calls. And I think maybe there were 20,000 calls or so in the first year. It was really a grassroots kind of situation. And it grew over time. But fast forward to 2020, when the National Suicide Prevention Lifeline Improvement Act was signed. and a 3-digit number was soon after designated. A lot of individuals worked very quickly to bring that network together. And for the first time, state funding, well, not for the first time, there were states that provided funding before that. But it really, I think, gave a lot of folks the political will to put state funding together. The Improvement Act also allowed for the first time states to actually legislate funding, so they actually could put together, and you've probably heard, I think there are 10 states now that have surcharges on cell phones to help support it. So that's one way that it's being funded. States are finding all sorts of different ways to fund it. SAMHSA has put a significant amount of funding into the states to help get things started. And now states are all working on sustainability plans, essentially, to help keep it funded over time. So it's a little bit confusing. It's not simple, but it's certainly a lot of state and federal partners have come together, and then private partners. Certainly all the centers across the country have come together to stand up the network. Part of our responsibility, in addition to ensuring that there is quality amongst the network centers and that everyone's adhering to the same practices and policies so that no matter where you call, you get the same caliber of response. Part of the rest of our responsibility is that we've stood up a backup network so that if a call can't be answered in a particular amount of time, that it rolls over to a backup network. And we contract with centers to have subrecipient centers that provide that. And then we also are responsible for administering the specialized services. So we help make sure that calls get to the Veterans Crisis Line if you press 1. We administer the Spanish subnetwork if you press 2, and then the LGBTQIA youth line if you press 3. And we're responsible for that. So again, we do a lot to help support the network. The centers are working hard to support their states, and states are working hard to support their centers. And then the federal government is doing a lot to support all of us. So it's everyone's working with their piece of the puzzle.
So before there was a 988, there was a 1-800 number. In between there was with another number and another kind of way for people. So what was it finally what did it finally take to kind of go from kind of the way that it has been done before to this place where we've now got the ability with a 3-digit number to really provide a life-saving resource to people?
I think there was a recognition that when you're in crisis, it's very difficult to remember a long number. And there was a lot of work. The FCC got involved, carriers got involved, and I think we've finally had the will to get together to say that a behavioral health emergency is just as critical as a medical one. And we also need a 3-digit way to access immediate care. So it's pretty incredible. Again, when I started working in crisis call centers in 2005, I could not have imagined that this would happen. So it's a really incredible feat.
So this may not be important, but it may be of interest to people. So why 988 as opposed to some other number?
Actually, I don't know. I think a lot of different numbers were, thrown around. I can remember feeling very gratified that they put a 9 in the number, and that the next two numbers were the same, so that it's very similar to 911, but not 911. I think a lot of discussion happened at the time. I wasn't at that table, but I do remember discussions being kind of adjacent to those discussions. And at the end of the day, I was really gratified to see that, for me, it seemed symbolic that a 9 was put in the number.
Yeah. So when 988 was first rolled out, kind of in a very ubiquitous way, what was the response kind of to that in terms of the usage of it?
So and I think you just have to look at volumes to see, over the first 2 years, we've seen 10 million contacts. So we had an extraordinary increase in volume. Text response was added at that time as well, which made a significant impact. And if you think about it, we know that the vast majority of individuals who are texting and chatting with us are under the age of 25. So to me, it's kind of a watershed moment. Certainly I'm, of the generation of folks that are willing to pick up a phone. I have 4 children who are not willing to do that. So to me, it's tremendously gratifying to see that that number of the numbers of texts and chats that we see. And just knowing that so many of those are younger people who may not have been willing to access the service prior. So not only is it an easier number for people to remember, and we're certainly getting better traction that way, but knowing that we're getting people to reach out through a mechanism that's more comfortable for them makes a huge difference. And I'm very proud of that.
So when someone calls or texts or chat 988, what is that? Kind of walk us through a little bit what that experience may be and what that engagement may look and feel like.
So and I'm glad you used the word engagement, because that's exactly what we're aiming for. So the initial response, whether it's text, call, or chat, is really the crisis counselor asking, how can I help you today? And it is really our practice that those counselors work on what we call active engagement. That we're really trying to engage with that individual, to listen to their story, to listen to the reason why they're contacting us, and then working with them collaboratively. We call it collaborative problem solving, really to help work collaboratively on what's going to be the most helpful thing for that individual today. But it is engagement is a beautiful word for it, because that's exactly what it is. And that's what makes 988 very different than a call to 911. 911 is a critical safety net, but 911 really is a triage point. Do you send police? Do you send fire? Do you send EMS? 988, that conversation is an intervention in itself. And very often that's exactly what that individual needs.
And so with that, when you engage in that conversation or that discussion is confidential. The information you share, what can be somebody's expectation of what that engagement might feel like and look like?
Yeah, certainly it is. The individuals can remain anonymous, and there are times when people choose not to. So that's an individual decision. But that conversation, at some point in that conversation, we require that the crisis counselor inquire about suicide and about that individual's safety. We are the Suicide and Crisis Lifeline, so it's really critical that we ask that question. It's also important to know that that's not the only reason why people contact. And I'm actually glad that we've expanded the name, and it is the Suicide and Crisis Lifeline, because there are many different reasons why an individual may want to reach out to us. But it is absolutely an opportunity for someone to, have a confidential conversation about what's going on with them. And it's really important that we think of it as a collaborative process. We are not doing something to someone. We are helping them to come to what we hope is their own decision-making about what will happen next. And we're there to facilitate, to provide resources, and to help make a connection.
And so because 988 operates obviously all across the country, if I'm a Minnesota resident, mm-hmm. and if I call 988 and I happen to be in Seattle, Washington, mm-hmm. how does that process make sure that I'm getting localized resources where I'm at, as opposed to where I may live?
So you're asking a very timely question. So currently, the way that the network is structured is that calls are routed by area code. So if I pick up my phone, I'm in Atlanta. If I pick up my phone, I have a Georgia area code, I would be routed to the center that answers for that area code specifically. If I call and perhaps my call rolls to another backup center because the Atlanta center is busy, the expectation is that whoever picks up that call, does everything they can to connect me to local resources. But the most important thing is that, that there's a caring, and trained person to answer that call. And then we work on connection after we establish safety. The great thing that's going on very shortly here is that we are working with all of the carriers to have what's called geo-routing. So geo-routing will change that. So the challenge today with phone calls is that if I'm going to New York on business next week, and if I were to call 988 and I'm in New York, I would still get the Atlanta call center based on my cell phone number. When geo-routing goes into effect, which will be very soon, I will be routed based on my location, not based on my area code. So I will be routed based on the closest cell phone tower. I will be routed that way. It's important to know that is very different. Geo-routing is very different than geolocation. So geo-routing is a generalized approach to a cell phone tower. We're not looking for that individual specific location. We are looking for them to be routed to the center closest to that tower. We are not geolocating people. It's important to note that.
Well, and that's interesting, and that's an important point because I was at the American Association of Suicidology conference earlier this year, where this whole conversation about the distinction between geo-routing and geolocation and why that was important, and so maybe just kind of share why is that important, and why is that particularly important to certain demographic populations, knowing the distinction between the two.
Yeah, certainly. There are certainly privacy concerns related to being geolocated. Certainly, geolocation is something that 911 can do when they are in a situation where they're trying to find the location of an emergency, and that it is possible for that to happen. But there are a lot of privacy concerned about that, and we do not want people concerned about reaching out because they think we're going to try to geolocate them. And if people want to contact us anonymously, we want them to be able to do that. And certainly we don't want people to be fearful about reaching out. So it's really important that we make sure that they understand that distinction. We do let individuals know, though, that if we are very concerned and that they are at imminent risk after a thorough assessment, that we would like to work with them collaboratively to get emergency care if they need it. But we are not the ones who would ever geolocate someone. In the event of an extreme emergency, we would collaborate with 911, and a lot of the time that is done in collaboration with the individual, and they've agreed for that to happen.
And so what would happen there is you would transfer them to 911 as opposed to you yourself identifying their location?
Yes, we would patch in 911 as a three-way call and work with the individual on getting emergency services to them. And very often that would involve like a suicide attempt in progress or someone who had already been harmed.
Yeah. So one of the things that we talk about when we talk about 988 as a resource for folks that may be in crises or just needing someone to talk to is that it's also a resource for people who are trying to help somebody who is in crises. So can you talk a little bit about that? Because I think it's important that we also broaden that scope or widen that net, if you will, because, as you can appreciate, we often get calls and outreach from someone who's saying, I've got a child or I have a friend or a family member, and I don't know what to do here.
Yeah, two things. So one is, a crisis can be very different. For a crisis to you is different than a crisis is to me, right? And we don't want people to think that you can only reach out if you're having a crisis or if you're thinking of suicide. There are any number of stressors and relationship issues, all sorts of things that happen, substance use issues, all sorts of issues that people would need to talk about. And we would hope that people would call before they are in a significant crisis so they can get care. So we want people to know that. But we also do want others to know that if you have a family member or a loved one that you are trying to help, 988 is also for you. We really want people to feel comfortable reaching out to ask for support. Help navigating getting help for a loved one is not easy. And I've been there myself. It's part of the why of why I do what I do. I have a family member with a serious mental illness and have had to help navigate that with them. And it's not easy. And sometimes loved ones need to be able to reach out to ask for advice and guidance on how to engage their loved one in care, or what to do if they're concerned. And 988 is definitely a resource for that.
And so talk a little bit about the people on the other end of that communication. These are folks that are trained, right? So this isn't just you hire somebody and say, okay, engage with folks.
Yes, they're highly trained. I have the privilege of part of my responsibility is overseeing our standards training and practice staff at the Lifeline. And yes, our responsibility is to make sure that there is a training standard across the network. Our call takers, people taking calls, texts, and chats are trained. They're trained in active listening. They're trained in collaborative problem solving. They're trained in engagement. They're trained in assessing for safety. They're trained in all of those things to make sure that they are prepared to help individuals in need.
So in the relatively short time that 988 has been there, as you look at the future of it, where do you see kind of either future opportunities with it or expanded utilization or impact from 988?
I think future opportunities are related to the growth of the whole crisis continuum. The hope is that 988 is the first piece of the puzzle. The hope is that in the next several years, that not only will people have access to 988, but they will have access to mobile crisis response in their community if they need it. And they'll have access to crisis stabilization programs. So if the call or text or chat is not enough, that someone needs a face-to-face response, that there is mobile crisis response available. And then if that isn't enough, that there is, a place for people to go, if they need more than that kind of response. And the hope is that we, work really closely with everyone on gluing that continuum together, being the glue to make sure that people can get what they need when they need it. I think the other opportunity is to make sure that we are really paying attention to who needs us and who's not reaching out to us. Are there populations that we know who are at risk, who need care, who aren't reaching out, and what can we do to help make that happen? There's some really great work being done. The Ad Council and the National Action Alliance have done really great work on trusted messengers. Who do we need to carry the water in the community to make sure that people know about 988 and they feel safe reaching out to 988. So there's a tremendous opportunity not only to make sure people get the care that they need through that whole crisis continuum that's developing. And again, 988 is the first piece of that, but also how can we, make sure that 988 is known just like 911 is, that people, children know from a small age that 988 is available. We have a lot of work to do, but it's I'm really gratified to see how much has been done in just a short period of time.
So when you talk about mobile crises response,
mm-hmm.
how is that different than calling 988? What does that mean?
So I worked in mobile crisis a long time in Georgia, in communities where mobile crisis is available. Sometimes it's, two individuals in an unmarked car who are trained in crisis intervention who go to wherever the crisis is. I did that for many years. So it's really an opportunity to go to wherever the crisis is and listen like you would on the phone, but do that in a face-to-face manner and help to intervene that way. If you think of it, if you look at a parallel, right, you've got 911, sometimes they send an ambulance and sometimes they take you to the hospital. Well, in this instance, you would send a mobile crisis response to help intervene.
So as folks kind of get to know the system more and get to understand it, and you look at the opportunities for growth and making bigger impact, what are some of the challenges or what are some of the resources or needs that the system needs in order to continue to meet the demand?
I think we need a workforce. We need individuals to do this work. It's challenging work, and we need that. We need funding to continue coming through. We need state funding to continue coming through for plans for that to be sustainable for the future. That's really critical. We need word of mouth. We need people to, like I said, carry the water in the community to let people know that about 988. And we need the rest of that continuum, and we need resources. If that call, text, or chat is not enough, we need resources to connect people to. We need accessible resources in the community.
And as far as policymakers go in states, and when you talk about resources, resources in terms of money to continue to build the system out, is it to hire more people, to train them?
All of the above, exactly. Resources to make sure that mobile crisis response is available, that the contact centers that are answering the calls, texts, and chats have the resources they need to staff, to continue providing training. All of those things are really important. I often say the last thing we want, we don't want people getting care in the back of a police car. People don't want police cars in their driveways. And unfortunately, in many communities, that's what it has been. And this is such a tremendous opportunity to change that, to really have a mental health response, a behavioral health response, instead of a carceral one or a medical one when it's not necessary.
As a parent of two young adults, a 23-year-old and a 21-year-old, I'm older than you, but you and I are the same general generation where we pick up the phone, we call people, we talk to them. My kids, if I call them on the phone, there is kind of like this instant paralysis. They're not really quite sure what they're supposed to do. What am I supposed to do if I answer that phone, and why is he calling me, and can't he just text me? For this generation, this kind of resource and how it's being provided, to give you the opportunity to call if you need to call, give the opportunity to text. If you don't want to call, give the opportunity to go on the computer and do a chat. Enormously useful, timely, necessary in the world that we live in. And so, as I said to you at the beginning of this conversation, this half hour is going to go fast. We're kind of coming to the end of that. Is there anything that you want to share with folks about either the resource itself or some message you want to communicate to them about how do they make sure that we continue to build and improve this system?
I'm tremendously thankful for all the work that's already been done. I think my biggest ask and hope is that people continue to get the information out there. It's such an incredible resource. and to help us advocate for more resources in the community so that people have what they need. If that call, text, or chat is not quite enough, right? We need resources for people, and for people to know that there are specialty resources. You can press 1 if you're a veteran. You can press 2 for Spanish-speaking services. You can press 3 for LGBTQ youth services, and to know that those services are available. It's really important.
And in addition to that, if you're not the person that's in crises, but there's someone else that it serves all the same purposes, and it's for the same end goal, which is to help someone through a crisis, to have someone to talk to, and hopefully help save a life. So, Wendy, thank you for the work you're doing. As one of our followers said, be proud of this work. It's one of the most important assets out there, and no truer words were spoken. Thank you for all of the work you've done so far and the work you're going to continue to do in this space.
And thank you to SAVE for all that you're doing as well. You're making a huge impact.
Have a great weekend. Thanks, Wendy.
Thank you. You too.
Bye-bye.
Bye-bye.